The economic toll of the virus is staggering as nearly 10 million people filed for unemployment over the past 2 weeks. Take a look at this line of hundreds of people near Miami risking their health to apply for unemployment benefits at a library. The line was already snaking around the block before the library even opened up in the morning. Applicants say that they have had no luck making their claims online or by phone, and many are picking up paperwork for multiple family members. And joining us now to talk more about the situation in hard-hit New York and the federal government's response, New York Senator Kirsten Gillibrand. Thanks so much for taking the time to talk to us, Senator.
Of course.
Let's start right off with Governor Cuomo. Today, he expressed hope that New York is reaching a plateau. Hospitalizations were down yesterday, and as of now, hospitals have enough ventilators. Do you think that the supplies in New York State will be enough, and does the state still need more help?
The state needs a lot more help. We don't know if we are at a plateau yet, and we don't know if we've even reached peak yet. And Governor Cuomo is doing his best every day to make sure we have the ventilators we need to have life-saving care for New Yorkers. I've been talking to hospitals all across the state, and most hospitals have a need for PPE, the personal protective equipment such as masks and gowns, and most don't know if they have enough ventilators for when they reach peak. So the truth is, New York is still in crisis. I've talked to so many people who have lost loved ones, and people are just afraid of the future. So we're trying to create a better supply line for medical equipment. We're trying to urge manufacturers to make the equipment that we desperately need. We're urging people to find ways to clean PPE, and a lot of the hospitals have figured out new technology to do that. We are being resilient and we are being resourceful, but we are no means through the woods.
President Trump removed Glenn Fine, who had been the Inspector General for the coronavirus task force in charge of supervising the stimulus spending. This is just the latest action that the president has taken against an Inspector General. What's your reaction to that removal?
I'm gravely concerned about that removal. President Trump is trying to undermine any level of accountability and oversight over the money Congress just appropriated. The purpose of Mr. Fine was to be the Inspector General, to create oversight over the entire $2 trillion package. And he was seen generally by others as responsible and capable and had been the IG for the armed services. So to remove him, to fire him, to replace him with someone who is not seen to be as credible is deeply troubling. This cannot be President Trump's personal slush fund for his buddies and for companies that he likes and states that he likes. Already we are seeing FEMA not actually getting PPE and ventilators to the states that need it. Unfortunately, we've seen FEMA using some criteria that's not based on need, and some states who aren't in urgent crisis like New York are receiving everything they've asked for or more than they've asked for. So I've written a letter directly to President Trump asking for review and oversight now that FEMA has an obligation to get those supplies to the states and communities that need it most, including New York.
And switching gears here, there's also been some serious concern about increased domestic violence with so many people confined to their homes. You fought for resources for domestic violence victims for years. Is there something more that the government could be doing to address this now?
Yes. So in the last bill, we got about $45 million in the bill after advocating for it to give more money to the domestic violence prevention not-for-profits and the places where people can go if they are seeking refuge and shelter. I've talked to a number of the domestic violence shelters in New York today, and they've said that they've seen an increase in cases because the court system is closed. They aren't able to get orders of protection quickly, and they've had to find ways to do that remotely. There's also a shortage in beds available because of the coronavirus epidemic itself. Normally, if you are a single individual, you'll share a room with someone. They can't share a room right now because they're not family members. So they're having to use social services access to hotel rooms to meet demand. So there's a lot of families that when we say stay home, shelter in place, that it's not safe. And so oftentimes they have to reach out for help and they're put in shelters. The shelter system needs more support. And so we need more of the SBA money to be able to flow to not-for-profits and not have the red tape we are seeing with this money we sent to the SBA. We've heard from a lot of people that if they don't have a regular lender who's an SBA lender, they're having difficulty getting the money that we appropriated for small businesses, including not-for-profits.
You've also long been an advocate for paid family leave, and the stimulus bill addressed that. But since then, the Department of Labor issued guidance giving small businesses broad latitude to decline to offer 12 weeks of paid leave. So what should Congress be doing to make sure that that single mom in Buffalo worried about her job is getting the resources that she needs?
So unfortunately, we tried to put paid leave in the second bill, but it ultimately, because of the actions of the administration, only covers about 25% of workers. We believe, those who support this bill, like Congressman DeLauro and I and others, that paid leave should be a right. It should be something that is a social safety net. And there's no better example than COVID-19 as to why we need it. If we had paid leave in place for all American workers, we would have already been able to have the structure whereby they could stay home for up to 3 months to meet the needs of a loved one, a child who's sent home from school, a sick loved one, or themselves being sick. It would have already been in place, and we could have sent money directly to the employers to pay for it. Unfortunately, we don't have paid leave, and our bill only covered 25% of workers. So hopefully it's the first thing we put in the next bill, national paid leave for every worker, along with 2 weeks of sick days.
And we saw some really messy scenes playing out in Wisconsin today. If this virus is still a threat in the fall, would you be in favor of recommending changes to how we vote in November?
Yes, I think we need to guarantee every person can vote by mail, and you could easily do it in every state through an absentee ballot system that is already in existence. And so what we would need to do is allow people to vote by mail early over many days and allow it to mail it in. Those ballots should be postage paid, so that's already paid, and it should be able to be mailed up until Election Day.
And there have been calls for Democratic leadership to demand some kind of provisions for the election in November as part of another stimulus bill. Would you be a part of that?
Very much so. We put some money in the last bill, about $300 million, to begin to allow for vote by mail and other types of remote voting ideas. And unfortunately, the many states are not using those funds to make those changes. In fact, Wisconsin today, the governor wanted to make the election later, but the legislature said no. And unfortunately, that put people's lives and well-being at risk.
Senator Gillibrand, thank you so much for talking with us today.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.